All right. So I'm happy to see everybody today. I'm here with my friend Bonnie Newlin, who is, I actually, would you introduce yourself, Bonnie, and give us all your credentials?
Yes, I'm Bonnie Newlin. I am a registered dietitian nutritionist. And I was just sharing before we started filming that my previous life was that I actually went to school for business and I worked more in like economic development type work. So I also have a Master of Public Administration from that old life in business. And then became a dietitian later in life. And I'm also a certified leap therapist, which just basically means that I have a little bit of advanced training in the way that food and food chemicals impact inflammation in the body.
Well, that sounds particularly oriented toward our topic, which is lipedema and nutritional practices to best serve lipedema. Can you tell us how you became interested in this particular diagnosis?
Yeah, my journey probably sounds like many of those listening. I have struggled with weight my entire life. I dieted my way well over 300 pounds and finally got tired of the rat race of fad dieting. And I would lose weight on these diets. And then the minute I quit doing, the strict eating protocol or tracking every morsel that I was putting into my body, I would gain the weight back. And I just thought there's got to be a better way. So I started researching and was able to lose 100 pounds, really just sort of diving into, better eating practices, quite honestly. And then I went back to school and became a dietitian after I lost 100 pounds. And then fast forward, after I became a dietitian, I lost about 40 more pounds. Things were going well. I started a practice. I was working with ladies that was centered more around finding happiness with their body weight and body balance. And then I got a lipedema and lymphedema diagnosis myself. And so I had a conversation with Dr. Herbst and she said, maybe you should consider working with the lipedema community. There's not many that have, your background in nutrition, but also have the patient perspective. So here I am. And so I'm a lipedema patient, but I also just happen to be professionally a dietitian. So I feel like it's kind of a marriage of the best of both worlds because I get it from both angles.
That's amazing. I know that that's got to be inspiring to your patients, especially with you being able to lose so much weight yourself and then maintain that, which is so challenging.
Yeah, and one thing I will say is that after the lipedema diagnosis, I think like so many women, I felt like I was sort of stuck in my tracks when I got that diagnosis. I had lost 140 pounds before the lipedema diagnosis a couple years ago, and I've gone on to lose more weight. So I've lost 173 pounds total with nutrition. And I think it's important to know that even when you have lipedema, you still do have control over things in your life, even when things can seem chaotic. What we put in our mouth is something that we can control.
That's a beautiful thought. And that's got to be calming to have that sense that there is something that is under your control and that if it gets out of control, you can bring it back. So,
Yeah.
yeah. So I wondered if you would talk about, we know that inflammation is a huge part of the problem with lipedema, with the pain and we believe with the weight gain. So how can you use diet to help reduce inflammation that's associated with lipedema in particular?
Yeah, my thoughts are aligned with the Lipedema Foundation guidance, and I think that there is no one size fits all approach. I really like to meet my clients where they're at. I think that it has to be an intersection of emotional and physical wellness.
Hmm.
I think everybody starts off their health journey from a different place, both in understanding and ability. But I think that following anti-inflammatory guidelines, no matter what you choose to do, is important. I think there's all kinds of different nutritional protocols that people can use to get to where they're going. But the overarching theme is really centering your intake around whole foods that are less processed, especially foods that are higher in, white carbohydrates and added sugars. I mean, we know those things are inflammatory. and they're just not good for us metabolically. And I think it's important to know that that doesn't mean you're never going to have a cupcake on your kid's birthday or on your birthday for that matter. But the majority of your intake really needs to be centered on more healthful foods. It's what you do consistently that makes, you know, I always say 80% of your nutrition makes 100% of the difference, because there is no perfection. It's what you do consistently. And I know that I did that myself, and that truly does work. But I think what happens is people get so mired down in trying to be perfect that they lose sight of the bigger picture. But in terms of anti-inflammatory eating, I think I circled around your question here. You know, including fruits and vegetables is important in my opinion, because a lot of our health comes back to our microbiome. That is the command center of our metabolic health. It's the second brain. It's the gut-brain connection. And feeding those gut bugs comes from fiber. So prioritizing fiber is important. As lippy people, lipedema folks, we need to make sure that we're eating plenty of protein to maintain the muscle mass that we have, because we know that we don't have mitochondrial enzymes functioning at the same level as people that don't have lipedema. So that's important, because we may not have the same energy burn, which can decrease our resting metabolic rate essentially, or calorie burn. And then including fats that are anti-inflammatory. And to take that one step deeper, if somebody has something like non-alcoholic fatty liver, really leaning into fats that are medium chain triglyceride that bypass the liver can be helpful. So depending on things that folks might have going on, there's different recommendations based on where they might be in terms of their health. But I think the main things are getting in fiber, getting in protein, and using anti-inflammatory fats, pro-health type of fats instead of the pro-inflammatory type of fats, and then unprocessed foods.
Yeah. I feel like you are echoing nutritional advice that I've heard in the world of oncology, in every health condition that we're treating that's chronic. It seems like it comes back to these same things. There's not one size fits all in any diet, with any diagnosis, but these whole food approaches with minimally processed foods seems to be so consistent across all diagnoses that I've ever looked into nutritional research regarding. And so do you have any, besides all that, are there any other specifics, or is everything really, you just have to know all those details so that you know if you're treating a specific problem like non-alcoholic fatty liver? That was really interesting information.
Yeah, I mean, there are other specifics. A lot of people with lipedema seem to have issues with the MTHFR gene. And so that's something else, whether or not we methylate folate, that I look at. I don't know if that's quite the question that you were asking, but I could get into a lot of different things. But I mean, there's so many things that I think we hear out there in the nutrition world. And back to your point, I mean, some of the cancers are estrogen dominant cancers. So it makes sense that the type of nutrition information that you're hearing come from me may be similar, because it's kind of similar in the way that the disease progression is. And so that's sort of the basis for my recommendations. But I think I like to take a whole history of who I'm working with and figure out ways to gear it toward them to make it work for them. Also, it does no good to tell somebody to do a certain nutrition protocol, one, if they don't like the foods that you're recommending, or two, they've got a bunch of kiddos and they're not going to spend, 8 hours a week prepping food. So I think it's meeting somebody where they're at. But I think that there's conflicting information even within the lipedema world. A lot of people here, you've got to do strict keto. No, you've got to do low carb. You've got to do Mediterranean. Don't eat oxalates. Don't eat lectins. And there are instances where perhaps all of those things might be true. But for the majority of people, when it comes to things like lectins, the anti-nutrients, as they're called, that are found in plants, If you're soaking your beans and legumes, you're probably going to be fine because that cuts down on the lectin load in those things when they're cooked. In terms of eating oxalates, which is another thing that I hear, there are people that can be sensitive to oxalates for sure, but for the majority of us, if we are cooking or steaming our vegetables, that cuts down on the oxalates by up to 30% just by cooking them. So that's fine for most people unless you have a history of kidney stones or something of that nature. So I think there's a lot of strict things out there that people hook onto before they've really had consistency with the basics, if that makes sense.
Yeah, it does.
And
Well, I would just want to amplify that term anti-nutrient is something that to me is a newer term. I've been interested in nutrition for about 20 years, but I just hadn't heard that. And so someone explained what that meant to me very recently, and it was amplifying the concerns around some of the things that are difficult for different individuals to digest.
right. And that can be true. I mean, the anti-nutrients are there in plants. I mean, it's a protective mechanism found in plants, I should say, for them to protect themselves from essentially being eaten by animals, right? Including humans probably, to a certain degree. But when we soak and prep these foods, most of them are fine for the majority of people. If somebody has, some underlying gut issue or IBS, then those foods may be a little bit less tolerable. Even with that, you can grow to tolerate them with exposure over time, because it does sort of go back to the microbiome. If somebody doesn't eat beans and legumes and they decide to go and have a cup, they're probably going to fill it later. So if you don't eat beans and legumes, you may want to start out with a fourth a cup and let your gut sort of acclimate to that, because you will populate, the microbial health to be able to digest those foods.
Makes sense. It's
Yeah.
like increasing your tolerance of anything, cold, any other kind of exposure thing. You can take it in small doses and eventually have a better tolerance.
And it works the other way too. And I can't stress this enough. I mean, I feel like people always sort of generalize that dietitians always say, eat the rainbow. But the reason that that's really important is when people eat a very narrow window of foods, they become more susceptible to food sensitivity. Because just for that reason, you're starting to diminish microbial health in the gut. And there are certain bacteria that lend themselves to certain better, instances of metabolic health. If we have a higher incidence in our gut of Bacteroides, we have better weight control. If we have more Formicutes, we tend to have more issues with weight gain. So there are gut, bugs that we can populate one way or the other to make our body balance easier, essentially.
That sounds fascinating. That sounds like a really helpful to be able to identify that. Sounds like a really helpful strategy for weight control. Is that something that the testing that you do can help identify?
That's I do that testing as well. That can be looked at through GI mapping, a GI map. It looks basically at just the composition of the gut. It looks at parasites, fungi, all the different things that may be present in the gut. And it also looks at inflammatory markers. So it's kind of a helpful test, but a lot of different functional physicians or dietitians probably offer GI mapping.
That's fascinating. I want to learn more about that.
Yeah.
Well, so we know that there are three macronutrients and they play a role in our health and our ability to process the foods that we eat. Can you talk about those for lipedema?
Yeah, I'm going to start actually probably backwards from where most people start. I'm going to go through fats, proteins, and then carbohydrates instead of the opposite.
Okay.
Fats are really important. I grew up, in the fat-free era where everything was fat-free, and I thought eating a box of SnackWells because they were fat-free was healthy. And now we know not to fear fat. I mean, we do need fats for digestion and absorption of the fat-soluble vitamins. And it's important to have fat for hormone production and hormone balance. So we want to have fats. We just want to make sure that we try and eat fats, especially when we have lipedema, that are not inflammatory. And we always hear that seed oils are inflammatory, which is true. They are more inflammatory. But maybe using olive oil, avocado oil, and if you need some high heat cooking, some unrefined coconut oil can be useful. That's a medium chain triglyceride, so that would be a fat that is beneficial if somebody has non-alcoholic fatty liver. And then protein is great because it helps maintain muscle mass and it helps with satiety. So getting in protein, I mean, I feel like right now the nutrition world is a little bit protein obsessed. There's protein added to everything. But it is important to get protein in. I don't know that we need some of the levels that I've heard on the internet out there, but you do want to focus on having protein at meals. And then the last of the macronutrients is carbohydrates. And I feel like carbohydrates, they get such a bad rap. And everybody always says, oh, I know I shouldn't eat carbs, but I love them. I mean, who doesn't love carbs? They're awesome. And one of the reasons that we love carbs is they're our short-term energy source. We digest them in 30 minutes to an hour. And so they give you that sort of instant spike in your energy, which can also mean an instant spike in blood sugar if we're eating refined sources. So when we're choosing carbohydrates, it's really important to choose carbohydrates that are higher in whole fiber. A lot of times what I see when people are trying to transition to a healthier diet is they get these products that are high in enriched fiber. And the difference is, and I just want to make this distinction because it's important, whole fiber will help to stabilize blood sugar and it lends itself to fullness and satiety, which is what we want. Enriched fibers are pre-digested fiber, meaning that they're really there to help with bowel motility. They do help with a little bit of blood sugar stability, but not to the same degree, quite honestly, and they don't give the same satiety that whole fiber gives. So that's one important thing. And I think it's important when people eat carbohydrates and they say, oh, I feel so full when I eat carbs. It's because carbohydrates, the hydrate part, is that they're partially water. They have you retain water. It's not that you're necessarily gaining fat. It's water that will sort of dissipate. So that's why it can be more important to watch body fat on a scale than body weight.
That's fascinating. So having a scale that gives you body composition can be much more helpful than just looking at your daily number for weight.
Yeah, and that's what I have my clients do, and it doesn't have to be an expensive scale. I mean, I don't have an affiliation with this company, but there's a scale on Amazon, Renfo scale. It's like $22.
Yeah.
And if somebody's interested in looking at some biomarkers, there's a degree of error there because it's just a bioimpedance that you're standing on. But if you're trending in the right direction, it can be helpful. And I find it helpful having a past where I've struggled with my weight. I'm not as concerned with my body weight, but I do sort of watch my body fat. And if I go out to eat like I did for Mother's Day and I go up 3 or 4 pounds, I look, is my body fat the same? Yeah. Okay, I'm good. It's just body water and it's going to go away. That's a natural process in the body. And we sort of get upset over those little, spikes, and we should have this downward trend all the time. And that's just not realistic.
Yeah.
The other thing with the nutrients that I'll say is, carbohydrates give that short-term energy. So they're digested in about 30 minutes to an hour. Proteins digest in about 2 to 3 hours. And then fats stay with us 3 to 5 hours. So a lot of times I'll have ladies say, I'm really hungry late afternoon. If I look at the composition of their lunch and there's not enough fat, that's why they're hungry. There's not enough fat there to carry you from a longer time period from lunch all the way to dinner, which tends to be a longer span than breakfast to lunch, for example. So it's good to have all those nutrients.
Yeah. Yeah. I think those are really handy tips. You know, I think a lot of people listening, whether or not they have lipedema, but most of us in the United States are trying to control our weight one way or another. Those are handy.
Yes. Yeah. And I think back to the whole food thing too, you know, and since we're talking about lipedema and lymphedema, I think watching the sodium can be important, because unless somebody is on a diet like a ketogenic diet where they may need to be incorporating sodium, eating out shifts the body water and can cause some electrolyte imbalance and all the things that we don't want to happen, more swelling and those types of things. So yeah, so
I think ultra processed foods in general tend to have a lot of added sodium. Is that true? It seems like I see that.
they absolutely do. Yeah. I mean, there's, you know, sometimes it's not, people will say, I don't add salt to my food. And I said, well, that doesn't matter, because these foods are packaged to sit on the shelf for gosh knows how long. And so the way to keep them on the aisle, so to speak, is to add sodium and preservatives.
Yeah.
And just because you swallow them doesn't mean the sodium and preservatives are gone. That means your liver has to process all these things. So that's a whole nother topic, is liver support, to make sure that we're getting rid of all these stabilizers and preservatives and guar gums that our grandparents didn't even have to think about, because they weren't ingesting those things.
Yeah. I mean, they're very recent in our human diet, and I think that's got to be really hard on our bodies.
Yeah.
Yeah.
Yeah. After World War II, when we wanted to keep those factories running after producing meals ready to eat for the troops, we turned into producing processed foods. And I mean, look, I have some processed foods, you know, occasionally too, because they can make life simple, but they can't be the majority of our diet. I mean,
Yeah.
they just can't.
Yeah.
So, yeah.
And I like that 80-20 concept that you shared. That was something, that's exactly what my oncologist told me. Try
Yeah.
to do the healthy things 80% of the time and you'll be fine. And it has seemed to be true. Well, all of this, it sounds like we are talking about healthy nutrition in general, not just for lipedema, but for
Right.
anybody. But I wonder if you have any, conclusionary thoughts about what can be done to help raise awareness and what important next steps are.
I think, you know, I think it's important to be an advocate for yourself, whether it's with your health care providers. I have clients say that they have to advocate with friends and family. I think it's important to know that there's no one size fits all approach. Just because something is working for someone else doesn't mean it's necessarily going to be the best fit for you. So really knowing what you're willing to do is one part of the puzzle, and what you can do at this moment in your life, which may change because we change as the trajectory of our life goes on, right? Maybe we're raising kids or caregiving or whatever it may be, our abilities may change. So I think really being realistic and honing in on what you can do for one is important. But you know, I think just keeping a good balance and realizing that there is an intersection between emotional and physical wellness, and they're equally important. So if you diminish your diet to the point where there's never any enjoyment anymore, then you have this emotional imbalance because life is no longer fun. So you also need to think about, what can you do for the long term? Like, what is sustainable for you? That's an important piece of the puzzle. That doesn't mean that we don't have boundaries with what we're eating, but really, what can you do day in and day out for the long haul? I hope that answered your question.
Yeah, I think so. I do think that keeping in mind that our cultural associations, our celebrations, these things
Yeah,
are important for our cognitive well-being, for our ability to stay healthy and happy for a long life. And we aren't going to sustain that if we're constantly having anxiety about everything we put
right.
in our mouths.
Yeah, when you look at the blue zones where people are living over 100, one of the key components is that social aspect of gathering and eating food and getting your hands dirty in the preparation. I mean, there's a lot to be said for the social environment that we have that impacts our overall well-being, and certainly our health, our metabolic health as well. It's sort of a whole person to look
Yeah.
at.
Yeah.
And I think that's one of the beautiful things actually about working with the lipedema community is the community that's here. There's a lot of amazing people in this community to support each other with, if we just reach out.
Yeah, that's for sure. This is a community that has been really fun to dance on the periphery of because it's such a warm and welcoming
It
group
is.
of people who want to be well, and
Yeah.
that's exciting to be around. Bonnie, is there any particular resource that you would recommend people take advantage of as they start to consider nutritional changes?
I mean, I will go back to the Lipedema Foundation. I think that they're a very unbiased, you know, advocacy and just a wealth of knowledge, and they have several blogs and resources. I have resources, of course, I'm going to say on my website at Crave Nourishment. So I would start there. If somebody's very into the science, I would say read some of the studies for yourself. I love Google Scholar and just plugging in, you know, lipedema and nutrition and see what comes up, and you can kind of read some of the studies on your own. But those are sort of the places that I like to start. There's the book, which I don't have handy right here, but the Lipedema and Lymphedema Nutrition Guide, which is a great starting point as well. So
Yeah, that book, when it was actually being prepared, I had a chance to review it, and that really helped change my life and the lives of many of my lymphedema patients who
yeah,
found that with a significant weight loss, with 10% of their body weight, that their lymphedema problems decreased dramatically. So,
yeah.
the healthy nutrition, trying to find a pathway to a healthy body weight can be beneficial for us in so many ways.
Yeah, it's amazing what, you know, just getting the inflammation, just getting a handle on some of the inflammation that we have an influx of coming into our life can really make a difference. But I think there are three other cofactors that sort of go along with nutrition, and that's getting good sleep, which is something that I think so many of us lack. Stress management, whether that's leaning into, you know, somebody's faith or a gratitude journal or a walk around the block to listen to nature. And then movement, not necessarily even with the intent of exercise, but just to release some endorphins. I mean, exercise is amazing too, don't get me wrong, especially for moving the lymphatics, but just to be able to get your body going and focus on something else other than, you know, the stress of what comes along with managing a chronic issue.
Well, humans are designed to move, and we really do have all kinds of downstream problems if we don't get that movement in. And so maybe we can blame the television remote device for cutting into our movement, because at least we had to stand up and change the channel when I was a kid. So
Yeah. And you know, even doing 5 to 10 minutes of a walk, even if it's just up and down stairs, if it's rainy after a meal, it really helps to resettle blood sugar. I mean, that can go so far in our metabolic health, and it's something that's so easy, but we get, you know, myself included, I start working and sitting in this chair sometimes, and I'll do 2 or 3 things, and hours have gone by and I haven't moved. And that's what we need to get away from.
well, that's a nice SMART goal that I think I'm going to set for myself based on this comment. I really like that. Just rather
Yeah.
than sitting right down after my meal, I'm going to just walk around a little bit. There's probably some little chore I can do in the house that'll keep me on my feet for 5 minutes.
Yeah, it's easy.
So awesome.
Doable.
Well, I think there's a lot of practical information in here for people. So I hope people will take notes because you've shared a lot of little practical details. And I really appreciate you taking the time to talk to me today. People will find links to your website and to the Lipedema Foundation. We had a nice conversation with Courtney Massio
Oh yeah.
recently. So, there's more information about that incredible organization too, linked from the Eros Medical website. So
Awesome.
thank you, Bonnie.
Thank you. Thank you so much for highlighting lipedema and lymphedema. I can say as a patient, we appreciate it. And as a professional, I appreciate it as well. So thank you so much.
Thank you.